Executive Vice President of Clinical Integrations and Customer Outcomes here at Intake Breathing. Today, we have a fantastic conversation, and I'm so excited to hear from Joy Lantz. Joy and I have known each other for quite a bit now, and she's such a phenomenal figure and such a prominent educator in the space. I'm so overjoyed to be able to work with Joy directly on a regular basis. Joy, do you want to introduce yourself to everyone and go ahead and say hi?
Sure. Thank you for that lovely introduction, Wes. Wes has a great team over at Intake, and I work with Wes and Derek really closely. And like you said, we've known each other for a little bit. I'm Joy Lantz. I'm from the Chicago suburbs. I'm a practicing myofunctional therapist, and I am an IBCLC. I'm a lactation consultant. So that's what I'm here to talk about tonight, myofunctional therapy and how much I love it. And we're going to get into it.
Amazing. So I see everybody's engaging with the chat right now. We've got Derek saying hello. We've got Tiffany from Vancouver saying hello. We've got Janine from Oklahoma saying hello. The chat window is going to be the absolute best way to engage with us live so that we can answer questions to you and participate with the audience. So in the chat window, if anything comes up during this conversation, please go ahead and put that into the chat window, and we will answer it live. Joy will give her perspective and answer that question for you. I'm just going to do a couple more here. Jennifer, I got a question that came in. Guidance on audio. If your audio is not working, can someone help me out here? Can everyone hear Joy and I? Do you want to just say another thing, Joy?
Yeah, let's make sure everyone can hear us for sure.
Can everybody hear us? Okay, fantastic. Amy, awesome. Thank you so much. We've got tons of thumbs up coming in. Thank you, Amy. Thank you, everybody. Fantastic. So we're going to go ahead and get started. Joy, you worked on the discussion today, and let me go ahead and share that for everybody.
Thank you. Perfect. Thanks again, Wes, for having me. And thanks to everyone in the audience who has come on to spend your evening with us. I know it's not easy to take time away from family, but I feel like this is a really important message. So tonight we're going to talk about myofunctional therapy, which is, again, my love. I've been practicing myofunctional therapy for 10 years this year. So really diving into a lot of history, but a lot of what's to come, right? What's in the future for myofunctional therapy. But we are going to take a look back tonight and learn about how myofunctional therapy truly is grounded in decades of clinical observation to start, right? That's how everything starts, by us observing and having a hypothesis about what we are seeing, and then starting the research, like really diving in to organize our thoughts and get the research so it is research-based. And we're going to talk about how this fits into modern interdisciplinary care, because that really is so important for our patients. We cannot take care of our patients if we have a very small lens that we are seeing our patients through, especially when it comes to myofunctional therapy. We know that we need support from a lot of different healthcare providers to get our patients where they need to be. And that's really, I think, something that I've seen recently evolving in itself, is getting out of that silo mentality when it comes to treating patients and really being able to work together. So that's what we're going to talk about tonight. And again, this is me. This is my background. I'm not going to spend a lot of time here, but my background is in dental hygiene. I've been a dental hygienist for almost 30 years. But for the past 10, I have been board certified orofacial myologist, and I do have my own private practice that I work in doing myofunctional therapy and lactation consultancy. So that's my love. So let's talk briefly about how long myofunctional therapy, or the concept of it, really has been around. It's been over a century of clinical observation and clinical insights into what our colleagues are seeing. So clinicians have been observing the relationship for a long time between muscle function, oral development, everything that pertains to the mouth. Breathing has come on more recently, I would say. I don't think they understood a century ago how integral breathing was to this relationship. But I would say within the past 10 or 15 years, we have really gotten a lot of information and a lot of research on how important breathing and how we're breathing is to what happens with our oral growth and development, and how that changes things with how our muscles actually do function and at rest. So it covers a lot. We can go to the next. Awesome. So clinical observations really came first to let's normalize where this whole field started. This isn't hocus pocus or voodoo. Edward Engel, back in 1899, wrote his first paper on Engel classifications, which is what we still use today to classify our occlusion in the dental field. That wasn't all Edward Engel was known for, though. In the early 1900s, around 1907, he started really observing other things happening, that teeth exist in a muscular environment. Again, when we are in dentistry, it's not the silo of just looking at the teeth. We need to look at the muscles and understand that the stability and how we use those muscles helps balance our oral environment. So some things he was noticing, relapse after orthodontics, wondering why this was happening, really making the relationship between tongue posture and how that affects the dentition. Where is our tongue resting, and what kind of forces are we putting on the teeth? And another big one, which I think is more recent, is how mouth breathing is really altering growth. But the father of modern orthodontics, Edward Engel, recognized this all the way back in 1907. So again, this work isn't new and the observations aren't new. So long before we knew what myofunctional science was and what myofunctional therapy was, we had clinicians in the early 1900s who were observing these things happening and describing the problem. So myofunctional therapy did not just appear out of nowhere. It grew from this early pioneer who recognized that muscles had a very strong impact on our teeth and our oral and growth and development. So Engel wasn't the only one. We're going to talk about some other prominent people tonight too who have some history in myofunctional therapy. So Walter Straub was an orthodontist back in the 1950s and 60s who really started making the connection between tongue posture and malocclusion once again, putting all the pieces together. And what he was trying to figure out is why certain malocclusions kept returning even after orthodontic treatment. Why do we get these patients who have relapses? Even the patients who are really good with wearing their retainers and doing everything that they're supposed to do under the advisement of their orthodontist. Why was this happening? So Walter Straub was, again, a pioneer in understanding that tongue thrusting was his big, his discovery, that the tongue thrust was what was contributing to it. So muscle function, forward tongue posture, leaning on the teeth is going to help move teeth forward. Excess pressure on our anterior teeth, lips and cheeks having a lot of pressure, all those muscles having pressure on the teeth. So what we practice in myofunctional therapy with our tongues on our palates, and that helps to balance out the muscles with our lips and our cheeks, right? It keeps everything balanced. So having an imbalance is going to contribute to not only oral growth and development in young children, but in that relapse of our occlusion. So his big idea was that orthodontic stability might require muscle behavior and teaching muscles. And when I explain this to patients, a big thing that we talk about is how orthodontics actually work. So when we put brackets on teeth and we put wires in those brackets, we are using very low, slow pressure to move our teeth where we want them to go, right? But if our muscles aren't working the right way and we take all the hardware off and we have low, slow pressure coming from the inside of the mouth out, that physics concept works the same way, but opposite the way we want it to happen, right? So that's how these relapse cases keep happening, sometimes more than once. I've had patients who relapse multiple times, and this is where it's coming from. This is the bottom line, is what the muscle function is pointing to. So that is another layer that really helped us understand how muscle connects with our teeth and how form follows function, right? Now, this book is an amazing book. It's by Daniel Garliner. It was written he started his work between the 60s and 70s. And it was one of the first attempts to really have protocols and to organize these observations that our early predecessors were having and putting it into words and helping to understand and portray to others how these concepts, it's hard to, even if you read the book, I have the book right here. It's amazing. It's amazing. And it talks about how he understands that it's hard to have these new concepts because even back then, it was still new. And even today, it's still new. But again, if you understand the underlying physics behind this, it totally makes sense. So the book is over 50 years old, and we don't really start publishing textbooks until we have enough observation and organization of the work to define that. And the wonderful thing about this book, has tons of different chapters in it that both relate to myofunctional disorders with speech issues, myofunctional disorders with dental issues. There are different chapters on myofunctional disorders and periodontics, right? Because of the physics of moving the teeth. Myofunctional issues and orthodontics, which we've already talked about a lot tonight, right? If we have the pressure on our teeth, what's going to happen to that occlusion? What's going to happen to that bite? Myofunctional therapy and pedodontics, how this really relates to how our kids are growing and developing. And if they're developing improperly, what are the long-term effects of that? What's going to happen with their airway and with their palate size and with their occlusion? So all of these things, again, this concept is not really new. This book has been around since the 70s. So we've known these concepts for a long time. It's just hard sometimes to really understand it because it's not taught in school. So let's move on to the next slide.
And before we move on, I think that there's a lot of those scenarios that you just mentioned that I'd love for us to touch on a little bit. If questions do come up, I mean, there's a lot of literature out in the world that your audience is leaning on heavily to help inform the way that they're engaging with their patients and with their clients. What literature are you leaning on? What are the questions that you have as this conversation is evolving with Joy? If you want to participate in the conversation, please use the chat window.
And I will tell you some of my favorite research. If this is something that interests you and you really want to take a deep dive, you don't have to buy this 50-year-old textbook. We have the Breathe Institute, which is doing tons of research currently to help make the connection between myofunctional therapy and lingual frenectomies, and looking at CBCTs and looking at breathing and just a lot of different things. Also being a part of the IOM, I am the current president of the IOM, which we're going to be talking about in a little bit, but we have our own journal, the IJOM, which actually last year we celebrated its 50th year of being published. So again, this is not brand new information. We are still publishing new research every year about myofunctional therapy and its relation to, again, a whole multitude of things, tongue ties and airway and how we're breathing and how it relates to speech and how it relates to dental decay. I mean, it does touch on a lot of different things.
A question came in just asking about whether or not this will be recorded and available. Yes, absolutely. So after the conversation concludes, we'll be sending this out in an email so that everyone can have access to it. It'll be available on YouTube so that you can watch it at any time. Great question.
Great. So now we're going to touch on the IOM, because there was a lot of, and there still is a lot of skepticism around myofunctional therapy. There are people that, have not really had any training and they think this is hocus pocus and it's just things that we're making up. But again, we do have books and research and literature that not just from 50 years ago, but very, very recent things. So skepticism is always encouraged, right? We want to continue to ask questions, but we also want to make this concept, myofunctional science is very consistent, and we want to have really great standardization in what we're doing. So with the IOM, that's really one of our biggest goals. Again, the IOM was founded in 1971. So this year we're celebrating our 55th year. And it was created because we really did want to try and streamline things, and currently have goals of standardizing our testing, standardizing education, making sure that we have accountability and we are seeing results in our patients. And it's really based in science that we can use to back up what we're doing with our patients. We are very lucky because this little graphic shows a lot of our founders of the IOM. And it was, a big group of speech language pathologists and dental professionals, whether it be dentists or dental hygienists. And this was the group that came together. It started in 1971 as a group of 13 people who understood this concept and really wanted to do a deep dive into this. And by the time we published our first journal article, the first president was Bill Zickafoos, and he has an article that he wrote in 1974. So from when they started in 1971 with 13 people to 1974, they grew to 175. So that grew pretty fast for a bunch of skeptics. But again, trying to have this code of ethics and this constitution that they work towards all together, understanding the same things and working towards a very similar goal. That's what we were founded for, and that's what we continue to work towards. So one thing, especially personally for me as a myofunctional therapist, is that breathing, nasal breathing in particular, is a non-negotiable, right? We cannot, getting that intake on. Nasal breathing is the number one goal for all of my myofunctional patients. And it is the underlying success in a myofunctional program. Because if a patient is not going to, if they can't breathe through their nose for whatever reason, they will not be successful in myofunctional therapy because of the other goals, right? The other goals that we expect patients to be able to do in myofunctional therapy is to have their tongue resting up on the roof of their mouth. So if they can't breathe through their nose, and I'm essentially asking them to seal off their mouth by having their tongue on their palate, it's not going to work. They're never going to feel comfortable enough to be able to get through their myofunctional goals. So nasal breathing is, yes, a physiologic necessity. We know all the background and the history with nitric oxide and what great things that's doing for our body. It's a functional foundation. When we have people breathing through their nose, especially kids, it's going to help with their growth and development. With adults, if you have not read the book Breath by James Nestor, it is an absolute necessity to understand just how critical nose breathing is to your entire body. When you mouth breathe, it affects your blood pressure. It affects your pulse rate. It affects your mood and how you feel. It affects so much more than just looking like Napoleon Dynamite. It's a huge deal. So I really recommend the book Breath. It's amazing. So early clinicians, yes, they recognize this before current modern airway metrics with our measurements and our CBCT things. They were able to see that just mouth breathing changes the way the jaws grow. So again, if a patient can't breathe through their nose, myofunctional therapy they will struggle because a patient has to breathe. That's the physiology piece, right? Your body needs to breathe. And if you can't do it through your nose, then you're going to do it through your mouth and you're going to fail with your therapy.
And that's really, where the foundation of the relationship between Joy Lantz and intake breathing was established was, intake breathing is the magnetic nasal strip that's out in the market today that has a pretty substantial consumer base. You've probably seen our advertisements across social media, but we've really, with partnerships like this, we're able to formalize the way that we're engaging with the community so that we can give really good language to support how nasal breathing impacts every aspect of wellness across a variety of specialties. In myofunctional therapy, this is a great cornerstone, being that nasal breathing is non-negotiable. So yeah, thank you so much, Joy.
Absolutely. So what's happening now is our science and our research is actually catching up to all the observations that were done, right, decades ago. So we have present research, again, through the Breathe Institute inside the IJOM to support muscle re-education and why that's so important. Orofacial posture, meaning what's going to happen if we have really tight lip and cheek muscles and our tongue is not on our palate? How is that going to change our occlusion? Now we have another layer of sleep disordered breathing, which is another huge win for the dental community. You know, in 2017, the ADA really pushed and recommended for dental offices to be asking their patients about their sleep, knowing that we are probably the front line of people who are asking about these issues and being able to screen for it. So all of that is tied into myofunctional therapy. And we have research on how myofunctional therapy can help assist patients who are in mandibular advancement devices, who are on CPAP machines. It's not going to cure, OSA. We're not looking for that. We're looking for compliance and what they need to be able to breathe better at night. And then we're honestly, our research is continuing to grow. Like I said, every year our journal is publishing new things. We are coming up with new hypotheses and new things that we're figuring out and having published. We just had Dr. Zaghi and his group publish again in the journal. So improving in quality, having people who understand how to do good quality research and publishing that is just going to back up myofunctional therapy more. And then again, becoming interdisciplinary. Again, we have, I know within my own practice, I have many people that I refer out to. So if I have a patient come in that just cannot nose breathe, right? We start with intake, but sometimes they need something more. Sometimes they need to see an ENT and maybe they need a procedure done. Maybe they need to go see an orthodontist because their mouth is too narrow. And, starting with me isn't going to make sense. So that's really a big part of being a great myofunctional therapist too, is knowing how to kind of triage your patients and structure their care plan in a way that makes the most sense for them. So we're not wasting time and money for our patients. And then the IOM's role today, what we're working towards is raising our standards, having the gold standard of certification. We, again, have our supporting research that is helping to back up our therapists that are doing the work. And I'm really proud that our organization is the only organization that does third-party examination for certification. So the same people that are educating you are not the same people who are putting you through your testing for your certification. So your education is verified, and that's how you come through the organization to become a board certified orofacial myologist. So again, touching on what standardization looks like now, the IOM has our certification pathways. So if you are interested in the IOM, you can come to our website, you can become a member. We do have continuing education expectations. If you are a certified orofacial myologist, we have annual conventions that you can come to where we stack speakers. We have a wonderful lineup for this coming year. We're going to be in Hawaii in October. So if anyone wants to come to Hawaii and be part of our group, we have a whole variety of speakers talking about TMD issues, we have an ENT coming, we have a doctor from Japan coming, we have a pediatrician coming. So we have, again, a wide variety of different perspectives to be able to dive deep and learn more about how that interdisciplinary care really makes a huge difference for our patients. Now we move on, an emphasis on ENT and dentistry. I mean, those are probably the two biggest collaborators that I have. And making sure that we are getting out of the silo care, right? So if one hand doesn't know what the other hand is doing, we can't fully take care of our patients. We are not going to be able to take care of everything. So success for my myofunctional patients absolutely depends on their airway being clear, because what are we going to ask our patients to do? Again, the 4 goals of myofunctional therapy generalized is to, nasal breathe, being able to rest with their lips closed, having their tongue at rest on their palate, which essentially is going to seal off their mouth, and then being able to swallow without having a tongue thrust. So if we can't get past that first goal of having nasal breathing and having that patient be comfortable, then we need to figure out what's going to happen, whether it's going to be an intake breathing strip, whether it's going to be nasal lavage, whether it's going to be an appointment with the ENT to address deviated septums or turbinate issues, tonsils and adenoids, whatever is going on to restrict that flow of air through their nose. That really has to be number one, making sure they can breathe through their nose. And then working with our dentists and orthodontists to make sure they have enough space in their mouth, right? So we know if we have patients with very narrow palates, the next step is I'm going to ask them to hold their tongue up to their palate at rest. And if there's not enough space there, it's not going to be comfortable, and a patient is not going to want to do that and not think about it and have it be their new normal. It just won't happen. So depending on what we see in our patients, that is going to dictate kind of where the myofunctional therapist and their role comes into caring for that patient. Yes, we always want to help pattern and make sure that we are changing their physiology, but we really need to make sure that the structure is ready for those changes, because the structure is first, and then we can help put everything back together. So again, it's kind of a little bit of both ways. It's established science, but it's continuing to evolve. So like I said, quite honestly, airway was not something that we learned about when I first came into the field in 2016. Airway was not big. It was not really talked about. It was kind of a taboo thing. So a lot has changed in the past 10 years, even within my own organization, with us understanding how big of an issue nasal patency really is, and making sure our patients have good airways. So we are constantly pushing the field forward. We want to make sure that we're collaborating. That's why we make sure when we host our free webinars for our patients, or when we host our annual conventions, that we bring other thought leaders from other disciplines into the mix, because we deal with collaborating with other healthcare professionals all the time. So this is not something new for us. Evidence-informed referrals, again, making sure that we are triaging our patients, making sure that they are starting at the right place that makes sense for their case so they can have the best success. Continued learning. I mean, we're nothing if we're not continuing to learn. That's a big part of being in this field, is coming to CE events. And again, just within the 10 years that I've been in the organization, there has been a lot of change and a lot of new research that has shown us different things and what we need to pay attention to. So it's crucial to stay on top of that. And then, of course, having really great myofunctional research. We really, really need that to continue to support the observation, the organization, the standardization of things, to really have everything be based in science, research-based, evidence-based. So that research is really, really important. But it's also important to realize, again, this isn't a new thing. Myofunctional therapy and myofunctional sciences did not just arrive suddenly. We've just kind of been waiting for everyone to catch up to understand just how big of a piece of the puzzle that it is.
Phenomenal. And there's a great question that came in from Eddie Lett. So it's an amazing presentation so far. Thank you for sharing that. I'm so excited to have gone through this content as well. And so it sounds like Eddie Lett is asking about what states is board certification for? And then when did the program become board certified?
That's great. So our organization, like I said, we are celebrating our 55th year. So we have been established since 1971. And we're actually an international organization. So we have people that are part of our organization, not just within the States. We have people who are certified in Canada. We have people certified all over the country. We certified our first Chinese doctor last year, our first Chinese orthodontist. So we are continuing to grow and evolve. So no boundaries there, international.
Phenomenal. I'm going to go ahead and move on to the next slide and let you finish up.
think that's it. But I think the two big takeaways that I wanted to bring tonight, right? Nasal breathing is number one. That's the number one goal for our patients. And I personally have a lot of use with intake. I've used intake for probably at least, I would say, 7 years, starting within my own house. So I'm a huge believer, love intake, especially for my patients who, are having major issues with breathing. Again, sometimes we need those outside referrals, but it's a great way to start, and it impresses upon them. A lot of times patients don't realize because they're used to what their normal is. So they don't even know maybe that they're having issues nose breathing until we really dive deep into it. So nose breathing is always number one with a myofunctional plan. And number two, myofunctional therapy is not new. It has literally been around and recognized and observed for decades, right? So think about 1907. That's a long time ago. That's more than 100 years. So it's definitely been around for a long time. It's not something new. It's something that's continuing to be researched. And again, we are so grateful to our colleagues at the Breathe Institute and, proud of our 50-year-old journal that has been compiling research for that long in this field.
Great. Yeah, thank you so much for really speaking and investing time and energy into helping establish the credibility of myofunctional therapy. I know that there is skepticism and there's fear, but there's also research and grounded data and grounded science to help support the evidence of the outcomes that you're able to see. I'm so thankful for what you did today with this presentation. Thank you, Joy.
Of course. Thank you for having me.
Let me go ahead and run through some questions that we saw come in. One thing I want to jump into real quick. This is a great question. So any suggestions on intake for patients with very oily skin and not being able to keep it in place all night? So I am also somebody who has very oily skin. I have a nighttime skin routine that I use a moisturizer on my face. I'm scared of getting old, I guess. And so I pay attention to my skin. But in any case, I also just make sure that I clean my nostrils extremely well, but also make sure that you're using the right size in the right location. The right size is not meant to, show a visible large increase on the nostrils. That's not necessary. What we're doing is we're providing stability and rigidity for either the internal nasal valve or the external nasal valve. And so I'm going to take everyone through the two assessments really quick so that you can identify the proper placement for intake breathing. You can see I have visible internal nasal valve collapse. My nostril falls into the lateral wall of my nose, and that's with very minimal exertion. That changes with my diet. That changes with my congestion. If I get a little bit of a cold, it becomes worse. But in any case, what we're going to do is we're going to do the Cottle maneuver to identify middle third dysfunction of the internal nasal valve. Just simply open up. Then what we're going to do is we're going to do the lower third assessment. Take the tip of your finger to the tip of your nose and gently lift up, gently. Asking your patient to go through those two assessments is going to allow you to identify the proper location for placing the tabs. When I look at my tab, the steel disc, I'm aiming that steel disc for either the internal nasal valve in the middle third portion or the external nasal valve in the other orientation on the tab onto the external nasal valve going in the other orientation, just like this, placing the metal disc on that external nasal valve, the nostril. So it's a really important thing to do is to identify the proper location to use intake breathing. And then the right size is going to feel like the assessment. So if you do a Cottle maneuver, that's what the right size is going to feel like. You don't have to go very large. I actually use a small because on my internal nasal, where my internal nasal dysfunction exists, I'm only looking to provide stability for my internal nasal valve. And so my small stabilizes, it provides rigid structure. It allows me to breathe more easily and more consistently through my nostrils. So placement of tabs is incredibly important, and the size of the band is incredibly important. Fantastic. Is there anything you wanted to add to that, Joy?
I think that's a great question. I think that's not only a great question, but it's a really good assessment with your patients. So if you're new to intake and you're not sure how to screen people, that's a really quick and easy way to show people how to use it and where to put it.
There's also other considerations too. We have really great training programs as part of our wholesale. I hate saying wholesale, but as part of our wholesale partnerships programs, we have really great trainings so that we can look at other considerations. Like if you have a deviated septum, something that you can do is you can actually install your intake at an angle, keep the tabs in the same location, install it at an angle so that you feel gentle lift on the side with the deviated septum. And you can actually feel significant improvements in that way as well. So great partnerships program. And that actually ties into another question that we saw here. Let's see. Can you order intake in bulk for MyoKits? Fantastic question. So we have a really phenomenal wholesale partnerships program. I like calling it partnerships because we do far more than simply offering product available for wholesale. Our wholesale program is very easy to get started. Everybody that's signed up for the webinar is actually going to get an email with that information available, but you're also going to get exclusive discounts because you watched today's event to be able to take advantage of our really great partnership program where you can get started with very minimal costs. My favorite thing about the partnerships program that we've recently launched is we do this phenomenal program where we actually send out email blasts to your local community, letting them know that there is a new professional in the space offering intake breathing at their location. So this is really, there's this kids book, Joy. I say this all the time, but it really makes me happy. There's this kids book. It's called You Lift Me Up. And the whole theory is that you lift me up, I lift you up, and we all get lifted up together. It's really beautiful. It's really simple. And that's how we operate our business.
That's so amazing and so generous of you guys to offer that. That is really, I love that about you guys.
Yeah, thank you so much. And then this question came in. Let's see here real quick. I'm having a little bit of trouble showing it. This is this question. I got it from my son and it comes off during the night. He says he's not taking it off. Do you think it's a size issue? I think that there's a potential for us using it the incorrect size or potentially using it in the incorrect location. Sometimes one of the things that I've had to use is a mouth tape in order to help me become more comfortable wearing the product at night. Mouth tape is not incredibly popular and it's not something that everyone wants to do all of the time. I have a beard and I'm very sensitive to mouth tape. I'll tell you, I'm very, very sensitive to mouth tape. But for us, it's important to identify the proper location, but also use any tool that we possibly can to ensure that you have the best experience possible while you're teaching yourself habitual nasal breathing. If you've been breathing through your mouth unconsciously for years, it's going to be a journey for you to train yourself to subconsciously breathe through your nose. This is a phenomenal tool to use in adjunct when you hear feedback that comes in like that. To help use other tools to help it become more of a comfortable experience. In the case of your son, if the adhesive tabs are coming off in the middle of the night, the first thing I want to focus on is cleansing the skin before you apply the tabs. Make sure it's clean and make sure it's dry. The next thing that you're going to do is identify the right size and the right location. Ensuring that you're wearing the right size and the right location will help you have the absolute best experience possible. If you go too large, you will put extra strain on the adhesive and it's really unnecessary. All right. Let's go ahead and here's another question from Tenna. When are you instructing clients to wear it? I'm gonna let you answer this, Joy.
Yeah, I mean, I love, especially when I'm retraining, that was a great point. Like it really is a journey. If you are a patient who's been mouth breathing for a really long time, you can't just expect someone to make that switch. So I always practice this with my patients during the day. Although if they do have trouble sleeping, they can wear it at night also. But when we are switching, especially from mouth breathing to nose breathing, I like to do a lot of practice during the day. We practice with mouth tape during the day once they're comfortable. We practice with intake breathing, the nose, so they can feel what it feels like to have that nose open. Like I said, a lot of patients, they're so used to being plugged up. That's their normal. So sometimes one piece is enough. sometimes we need the mouth tape too, though. But yes, I always practice during the day first to get them comfortable.
Thank you for sharing that. I hadn't even thought of that. That's so smart. Another question came in from Amy. This is directed towards you. Joy, do you use these for every patient?
I wouldn't say every patient. I mean, all the tools that I use are very targeted for what patients need. So when I'm doing my, initial intake with people, that's going to give me clues for the patients that I'm going to use these for. But I wouldn't say I use them for every single patient that comes in where, everyone needs it.
Thank you for sharing that.
Sure.
Andrea posted a question here about the availability of product in Canada. And I want to take this opportunity because I know that we have a large Canadian audience as well. The trade challenges that currently exist, we're a small family-owned business based out of Santa Barbara, California. And while that's typically endearing for the US population, that kind of falls flat for our Canadian neighbors because of the challenges of trading into the region. In any case, what I would advise you to do, Andrea, I'm going to speak with Derek so that we can get a personalized conversation started with you. If you can be that individual in your local area that offers intake breathing to your neighbors, that would be a phenomenal opportunity to engage with your local community and really start that conversation around nasal breathing. We are committed to solving import into Canada. It's one of our biggest priorities this year, and we will solve for that. But there's an opportunity for us in the meantime to work with you one-on-one so that we can get product into the region and help support your local, your neighbors. So I'd love to explore that conversation, and Derek from my team will follow up with you to get you that insight. All right. And then last question, feel free to ask any questions. We're about to wrap up here. I only see one more. I'm gonna go ahead and put this one up. This came in from Chrissy. How do I find your training sessions? So when you join our intake professional partnerships, we offer individual training sessions with your hygienists, with your myofunctional therapists, with your staff, with the entire team so that you can get comfortable about the assessment procedures and just the way to speak about nasal breathing and intake breathing. We have training sessions recorded on YouTube. These conversations this is brand new for us, Joy, and you knocked it out of the park. Thank you so much for what you did today. This was great. I'm excited to continue building these materials so that we can offer this out to our professional partners. But yeah, this was fantastic. I don't see any more questions coming in. Joy, is there anything that you wanted to say to everybody before we bid them farewell?
I mean, feel free to reach out if you have any questions for me, or if there's anything that, maybe you don't want to bring up to the group, but you're curious about, come and find me. I'm more than happy to walk you through how I choose my patients to use intake, or if you have questions about anything that I presented tonight, feel free. And thank you again for spending time with us.
Thank you all. And before we go, I just want to advise everyone too about dental codes for myofunctional therapy. Everybody that's attended the webinar is going to get an email from our team giving you information about our professional partnerships programs. We're going to give you all of this information. You're going to have everything that you need. I'm so excited to welcome you into that partnerships program. I can't wait to meet you all in person. And Joy, until we do this next time, thank you, everybody. Have a wonderful night, and we'll see each other soon.